Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. And with the coronavirus and its outbreak and the ramifications that all of this has in recent development, I wanted to share some information about coronavirus. So, first of all, what is coronavirus and how can we deal with it and lessen the chances that we'll get it? Well, the best thing to do is to arm ourselves with knowledge, and then we can take appropriate action steps to support and protect our immune system, and also do the best to avoid mass hysteria, which can be just as damaging as the virus itself. So let's talk about some science first. COVID-19 or coronavirus is not the flu. Influenza, aka the common flu, has been around for a long, long time, and there have even been some vaccines that have been developed to protect against it and also lessen some of the symptoms. And basically, the vaccines are our best guess of how the strains will present each season and are very limited by this process. Hence, they're only about 40 to 45% effective in adults, about 50 or 55% effective in children. But at best, it will generally lessen the severity for those who come down with the flu. However, at this time, there's no really tested, proven vaccine for COVID-19, and I'm sure they're working on developing this, but a good vaccine we know works won't be available for any time soon. And it takes time for testing to take place as well. Some say coronavirus is just like a cold, but it's not just really a cold. And it's a lot more severe than that if you're immune compromised. People who have compromised immune systems have diseases that affect the heart and the kidneys and the lungs and the liver, and they can be cancer patients, people on chemotherapy, or people taking autoimmune drugs. And so they're at risk. The elderly are also at risk. How do you define elderly? Well, typically it's someone who's at least 65 years old. So they can be at higher risk because, again, their immune systems aren't quite as strong, they're not quite as resilient to bounce back. Also, if you're a smoker or you're obese, then you're probably at higher risk as well. So the main route for the spread of the virus is through coughing, sneezing, and talking, and it's shared by robust viral droplets, and they can land on your skin, your clothes, your hands, and even your eyes, and be inhaled into your mouth and your nose. And in most cases, the COVID-19 symptoms will not be that severe, especially if you're young and healthy. It can be mild to moderate. But again, if somebody's immunocompromised, they're very elderly, then they can even be fatal. The symptoms can even be fatal. So what are some of these symptoms, you may ask? Well, typically with coronavirus, they're fever, cough, usually a dry cough, shortness of breath, fatigue, body aches, occasional diarrhea and vomiting, and in severe cases it can even become pneumonia. And how does coronavirus differ from the common cold or from influenza? Well, for example, as far as fever is concerned, it's fairly common with coronavirus, yet also common with the flu, but typically rare with the cold. As far as fatigue is concerned, sometimes you'll have fatigue with coronavirus or a cold, but it's typically more common with influenza. Coughing is usually dry with coronavirus as well as the flu, but typically very mild with the cold. You typically won't have any sneezing with coronavirus or the flu, but you'll have it with the common cold, obviously. Aches and pains will be rare with the coronavirus, whereas they're pretty common with the cold and the flu. You may have some stuffy or runny nose with the flu, but it's fairly common with the cold, whereas that's something you're not going to see with the coronavirus. It's going to be very rare. Sometimes you'll have a sore throat with coronavirus as well as the flu, but it's fairly common with a cold. Diarrhea is rare with the coronavirus, although you sometimes have it with the flu, And obviously it's not something you typically have at all with the cold. And you'll have headaches commonly with the flu, but they'll be fairly rare with coronavirus and a cold. Shortness of breath, however, is going to be the case with coronavirus occasionally because it does affect the respiratory system. And you're not going to see that with a cold or the flu. So those are just some differentiating factors between coronavirus and the common cold and the flu, and some of the facts about it, some of the common symptoms. So for more information, go to newhopechiropractic.com. And again, very important to keep your immune system strong. So that's why I encourage you not to stress too much, keep things in perspective, and keep up doing things that make you strong and healthy, like getting chiropractic adjustments, getting regular exercise, and focusing on a good diet and getting plenty of rest. I'll talk more about that in another segment, another video. And with that, try to have as healthy a day as possible.